Everyone. Happy New Year. Thank you for joining us today for the weekly COVID-19 media briefing from Peterborough Public Health. I am Brittany Cadence, the Communications Manager, and it gives me great pleasure to welcome you here to our first briefing of the new year. Certainly lots going on and lots of updates to provide you with. We'll let us get underway by taking a moment to find some gratitude and peace in this beautiful place that we have the pleasure of living in, and acknowledging our local connection to the Indigenous populations here. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, with that, I'd like to invite our Board of Health Chair, Mayor Andy Mitchell, to share his opening remarks with us today. Please go ahead, Andy.
Well, thank you, Brittany. I have spent almost 30 years serving my communities in both elected and staff positions at the municipal, provincial, and federal levels, and never have I felt so frustrated and discouraged. We are once again faced with social, economic, and cultural disruptions to our lives, just at a point when we thought we were putting behind such things as school closures, business restrictions, and social limitations. But here we are again. But despite what I may feel at this moment, and regardless of the unfairness of what the virus is doing to us, I will not be defeated. My community will not be defeated, and the people of Peterborough, city and county, will not be defeated. We will not only survive this, but we will thrive. I have always believed that hard work, dedication to mission, perseverance, and tenacity will solve any problem, and I still do. Today, our mission is clear. Keep people safe. First, by ensuring our healthcare system can care for the ill and keep the vulnerable protected. And second, to ensure our essential services have the staff necessary to continue protecting us. And we need to be focused. There will be lots of time later to discuss the what ifs, to debate long-term solutions to structural challenges, and to determine processes that lead to good evidence-based decisions. But just not today. For now, our mission is straightforward. Get as many people vaccinated as quickly as possible with as many doses as possible. Reduce individual interactions to slow the rate of infections and reduce the daily demand on hospitals. Keep essential workers well and on the job. Practice individual public health measures that will help to keep you and your family safer, but know that no matter how hard we try, infections will still occur. Despite what we face today, I want you all to know that you have made a difference. Almost 90% of adults who have been vaccinated have lowered the severity of this wave. The frontline, primary, and public health care workers have unfailingly attended to the sick and protected the vulnerable. Our first responders have answered the call and kept us safe. And essential workers have continued to serve us each and every day. We are grateful to all of you. So please, stay safe, be well, and in all things, be kind. Thank you.
Thank you so much, Mayor Mitchell, for starting us off with our inaugural 2022 pandemic update. And I'm just going to now invite our Medical Officer of Health, Dr. Thomas Pigott, to walk us through the next few slides. There we go. And let me just get you up on screen, Dr. Pigott. There we go.
Hi, Brittany. So I'll walk us through our situational update, and then I don't know if we want to. I know we have some municipal and provincial and leaders on the call too. So I'm not sure if we'll go to them then afterwards for any comments if they have.
Yeah, we'll do that after you're finished.
Great. So hi everyone. Welcome. Happy New Year. Happy 2022. I will start with our situational update here, and then I'll share some comments afterwards. So as of 4 p.m. yesterday, this dashboard is showing the number of active cases and the cumulative deaths we've experienced during the pandemic. I want to take a moment to note that with recent testing changes announced by the provincial government, we know that these current case numbers are now a significant underestimation of transmission in our community. And I would think that multiplying by a factor of 5 to 8 or even perhaps more is more of a true picture of how many active cases there are currently in the community. I'll come back to talking a bit about the PCR criteria a little bit later. It's hard to believe that on our last media briefing on the 23rd, we only had 208 cases. That compared to 59 cases the week before. So Omicron, as modeling showed, did result in exponential growth of cases. And this is what we're experiencing now. And this is why we need to do everything that we can to flatten the curve and decrease its impact on our health system. Sadly, this week we are reporting another death, a 30th death for our community during the pandemic. And I can share this was a man in his 80s who had had 2 doses of the vaccine. You can also see here that our case incidence rate is extremely high, the highest it has been through the pandemic at 482 cases per 100,000. This is, however, still lower than the provincial case rate of 651 cases per 100,000. On our next slide, you can see our information that we're sharing from the Peterborough Regional Health Centre pulled this morning from their website. And they are reporting 17 inpatients that are hospitalized with COVID-19 and 1 outbreak within their facility. On the next case, you can see the slide that shows from December and the first 5 days of January, the age breakdown of the cases that we've seen. And you can see continues to be significant case numbers and transmission in our younger population. Why it's really important that people who are eligible, including those now 5 years and older, get their vaccines. On the next slide, you can see our outbreak dashboard, and there are currently 9 active outbreaks in our community. And it's concerning to see them occurring in our highest risk vulnerable settings, but I'm really proud of the work that our team is doing to pivot and to support and provide increased help around infection prevention and control efforts in these high risk settings, and very encouraged by the strong support we've received from all of the settings in our community where they're experiencing outbreaks, who are very concerned themselves as well and doing everything they can to respond. We have already begun administering 4th doses in long-term care and retirement residences as well, and that will be very important to helping with the continued response in those settings. On our next slide, you can see our wastewater surveillance data over the past 2 weeks, and it confirms spread of Omicron, of COVID-19 in both the city and county of Peterborough. The data will continue to fall over the coming weeks, will be helpful in seeing now that case counts are not as clearly reliable, the increases and then hopefully decreases as we get through this Omicron wave. On our next slide, you can see our vaccination progress, and it's really exciting to see that 45% of local children aged 5 to 11 have received their first dose. That's good, but there's a lot more to come, and I'll come back to this later, but we've opened up over 1,000 new appointments, so if you haven't had your doses yet, please come forward, book, and get vaccinated if you're a 5 to 11-year-old. And there are still many appointments left for this weekend's clinic. So I really encourage all parents and guardians to get their kids vaccinated as soon as possible. And this will be really important to the safe return to in-school learning on January the 17th. From a population level, our community is getting there in terms of first, second, and third doses. I want to remind people that are needing their first or second dose that they can actually just walk into a clinic. We want to make it as easy as possible for people to get vaccinated. And if you haven't come forward yet, there's no time too late. And you can certainly come on in. And I think if you have had reasons or a reluctance to get vaccinated yet, it's not too late, and you definitely can still come forward, and we want to make it easy as possible for you to make that right decision. Thank you so much to our amazing local health professionals and the community and the efforts to ramp up vaccine availability over the past several weeks. It's really been heartwarming to see everyone kicking in, the hospital, primary health care, pharmacies, and all of our staff, among other partners, are truly coming together in a team effort. These numbers with vaccinations are important for another reason, because they tell us that a large majority of residents value this role of the vaccine in protecting themselves and those around them. And this is really important to decreasing the impact on our health system from this pandemic. So thank you to everyone who's getting their vaccine and keeping our community safe. I also want to just mention that it's very important to continue staying home if you are sick and begin isolating, or if you're a household contact of somebody as well. Instructions on this can be found either on our Peterborough Public Health website or on the ontario.ca/exposed website. And we really do need to all follow these measures and ensure that we work together in the response to Omicron. Businesses will be aware through communication as well of changes to Step 2 measures, and I know we've been working hard with the business community to help them make their environments as safe as possible as well. Okay. Brittany, I'll just check, should I continue with my other messages, or do we want to check in with maybe elected officials first, and then we can come back to my messages?
Sure. Why don't we do that? So let's, and I believe we have two of our area officials on the line, and I see MPP Dave Smith is joining us today. Great to have you here. And then maybe we'll follow up with Mayor Therrien. So MPP Smith, if you're here and if your camera's working, I'm happy to spotlight you.
Thanks, Brittany. Appreciate that. Thank you very much, everyone, for coming today. I know I haven't been able to make a lot of these Thursday briefings. Unfortunately, we've had caucus meetings that conflicted with it at the same time. Dr. Piggott was bang on when he was talking about some of the challenges that we're facing right now. If we take a look back to January 31st, that was basically the day when the health professionals came to us as the elected officials and said, we need to be looking at some serious measures as we move forward. 1,144 people in the province of Ontario were hospitalized at that point. Today, which is basically yesterday's numbers, we're well over 2,200. So it has doubled in the course of 6 days. We had 205 people in ICU with COVID-19 6 days ago. We have 320 in ICU right now, as of yesterday. In Ontario. It has grown exponentially, and we cannot let our guard down. There are a number of things that we can continue to do, and I truly appreciate that everyone is tired. People are tired of talking about COVID. People are tired of taking the measures that they need to take. But the more we do, the better we will be, and the quicker we will come out of this. Follow the health guidelines. Wear your mask, social distance, Get vaccinated. It's the same message that we have been saying all along, but it will work and it will get us through this. I do want to address one simple thing on rapid testing. I've had a number of people reach out to my office. I've seen it in the newspaper and I've seen it on social media. The question has been put, why do we not mail rapid tests to everybody in Ontario? Assuming we had enough rapid tests that we could do that, the reality is the testing fluid must remain between 2 degrees and 30 degrees Celsius. And in the month of December, we had one day in Peterborough that was warm enough that we could have put it in the mail. The other 30 days, those tests would have been rendered useless. And it would have provided a false sense of security to people because it would have come back as a negative simply because the testing fluid was rendered useless by dropping below the lowest temperature that it can operate at. If we look at other areas of Ontario, the last time that Timmins had temperatures that were warm enough that they could have been put in the mail was November the 4th. It is logistically not possible to send them out in the mail because they would have been rendered absolutely useless. I know that the pop-ups have not gone as well as a lot of people have hoped. I know that people have been lined up for it. We are still part of the pilot project right now, and we are working through those. It will get better when we have a good supply of it. At present, we have been short-shipped 15 million rapid tests. 15 million that were supposed to come to Ontario have not shown up yet. Our expectation is that there will be more coming. We have assurances from the manufacturers that they will be coming. And when we have a good, steady supply of them, we'll be able to distribute them better to more people more effectively. It's been my typical sign off on a lot of things that I have been on publicly about, but I'm going to use it now because I think that it is very, very appropriate. Stay positive, test negative, because we're going to get through this together. Thank you.
Thank you very much, MPP Smith. I'm so glad you could join us today. Okay, let's hear from our Mayor Diane Therrien. Happy New Year to you. And if you've got any remarks to share, I'm happy to put you up on screen.
Sure. Thank you very much, Brittany, and Happy New Year. It's, I guess, good to be back. I don't know. But it's nice to have these updates and to be in the loop on everything that's going on. I know that there's been a lot of uncertainty, a lot of change in the last week or so. So I don't have too much to highlight that folks haven't already said. There have been some recreational facilities closed at the municipality, obviously, that have been impacted by the COVID numbers. The only thing that I really wanted to reiterate, as we heard from our board chair, is to be kind. You know, small business, retail, restaurants, education workers, health workers, everybody is struggling right now and everybody's frustrated, but don't take your frustration out on those folks that are just doing their jobs. That's not helpful for anybody. We will get through this together. We've got great teams working on all of these fronts. And so I think I'll just leave it there, but just remember that we're all human. We're all just trying to get through this crazy world together. And so to treat people with kindness, I think is, you know, of the utmost importance these days. If you made a New Year's resolution to do one nice thing for somebody each day, that would make our community a much better place. So I'll leave it there and be around for questions. Thanks, Brittany.
Thank you so much, Mayor Therrien. Definitely agree with the importance of trying to be as kind as we can out there. Okay, let's circle back to Dr. Pigott to wrap up with some additional remarks, and then we'll move on to our media guests who can ask their questions. Go ahead, Dr. Pigott.
Yeah, thank you, Brittany, and thank you so much, MPP Smith and Mayor Therrien. Those were both very lovely words to leave us with today. So today in my remarks, I want to talk a little bit about how we can get through this January together. January blues were a thing before COVID, and after an unusual holidays, and now with many families home with their kids, I think this is going to be a very difficult month for some. So I want to encourage you to keep your connections to friends, family, your neighborly connections as much as we can, even if that's a phone call, a virtual visit, or an outdoor visit. It's really important to be kind and look out for each other. Look out for signs that people aren't coping well in the coming weeks in this difficult time, such as if they're losing interest in their usual activities. And in kids, especially kids who are home from school, this can look different as well. Kids may experience more anxiety or mental health challenges that may manifest differently. They may be more cranky or have different emotions. They may experience some physical symptoms like even headaches or belly aches or difficulty sleeping or appetite changes. And so look out for people. And if you do need help, please seek help. Through your healthcare providers. I think different people are managing with the continued pandemic in different ways. And I know that you're all just doing the best that you can. I think that finding routine and finding pleasure in our and amidst the difficulties is really important. Our family, for instance, we have a nice weekly routine, with one night being a games night, one night being a home cooked pizza night where everyone chips in helping to make it. We have a podcast learning night where we explore a new topic, and routine and some of these pleasure activities can be nice. And linked to that, try to cut back on your screen time if you can, because that's not going to help through this month. And if you can, get outside. Definitely bundle up and enjoy the Canadian winter. We have a beautiful region, and the parks and outdoor activities are so wonderful. So please try to get out and explore. It's also going to have the added bonus of being less risky for transmission of COVID than being tightly packed around others indoors. And don't forget about the gathering limits, which for indoor private gatherings now is at 5. Another tip to suggest and consider cutting back this month or cutting out alcohol, because alcohol can heighten anxiety and mental illness amongst its other health impacts. And ultimately, through this month, I hope that we can find hope in these darkest days in the pandemic. Omicron has changed COVID-19. It's like a whole new pandemic. There is lots of concern and uncertainty with what's happening, but there's reason for hope. And I really feel like there is light coming, and I really feel like we're at the darkest part of the night before the dawn that is coming. Most encouraging is the progress in the pandemic that we have with our vaccines. They are just scientifically incredible and doing wonders. With Omicron, they aren't stopping transmission. We know that people that are vaccinated can transmit, but they're doing a remarkable job of preventing severe illness and death. In Ontario, for every 5 people who are vaccinated in the ICU in Ontario with COVID, there are over 100 people who are unvaccinated. More and more people are protected with boosters, and now 5 to 11-year-olds are having their turn. And hopefully in the coming months, under 5-year-olds will also have their chance. So I want to also take a moment to especially acknowledge the importance of getting vaccinated if you are pregnant, because the vaccine is very important protection for both the pregnant parent and baby. So vaccines aren't perfect, but like seatbelts when driving, they are saving lives and incredibly helpful. But they can't be our only strategy. It still takes multiple things to keep us safe. Just like if you're driving, we have driver's license, safer roads, safer cars, airbags, seatbelts. All of these things add up. Not being distracted while you're driving. Like COVID-19 as well, it takes multiple layers of protection to make us safe. So on top of the vaccine, we need to be very careful about our interactions, wear our tightly fitting masks, ensure there's good ventilation, and start to use the rapid antigen testing like MPP Smith was talking about, and which will become more available in the coming weeks. I want to talk briefly about access to PCR testing, because the criteria has changed, as you're aware, and this was a change that was needed because those in highest risk settings weren't able to access timely PCR. And it does mean that our daily case counts are changing and are not a true reflection of COVID-19 as they have been in the past. But it doesn't mean that we're flying blind. You know, like a pilot in bad weather, we need to use other sources of information, other instruments, instead of looking out that front window. And at Peterborough Public Health, we're working hard to look at wastewater surveillance, self-reporting of the rapid antigen tests, which you can do to us, absenteeism, and then also the impacts on our health system, including hospitalizations and ICU admissions. So as much as the pandemic has changed, we aren't flying blind. I'm very encouraged that rapid antigen tests will become more available in the coming weeks as well. And the last thing that I want to talk a bit about is schools. I want to be clear, schools are not dangerous. This pandemic and this virus is dangerous, but schools aren't dangerous. Schools are an oasis of learning and development, and so important. For some, schools save lives. Schools may provide meals for kids who might not otherwise get them. It may be the way that things like domestic violence at home is actually identified and kids are protected. Schools aren't only important for social interaction and centers for learning. They're very important in broad ways. Everyone wants schools to reopen. I know especially parents, teachers, the staff, and the kids in the schools want them to reopen, but they want to feel as protected as possible. So we've been very concerned by this and working to make schools safer and to respond to these concerns. I've been working hard to support, and I'm in regular communication. Even this morning, I met with the school board directors. I'll be doing webinars next week for teachers and staff, as well as for parents and kids, in collaboration with the school boards to be there and able to support and answer questions. We're providing input and advising on masks, on ventilation, on testing, and otherwise that schools can be as safe as they possibly can. We're using surveillance now that case counts aren't as reliable. We're looking at other sources of information that I mentioned to help to provide a picture of what's happening. And finally, we're adding additional access to vaccines. This weekend, I mentioned for 5 to 11-year-olds, we've added over 1,000 additional vaccine appointments, and there's still many left. So please, if you haven't come forward for your first dose for your kid, if they're 5 to 11, please do so. And if you want to look at rebooking a second dose earlier, I need to mention NACI and provincial recommendations still continue to recommend 8 weeks before between doses for the increased effectiveness. But parents that choose to rebook their second dose earlier can do so. And you just call the provincial booking line to provide consent to do so. The number is 1-833-943-3900. And we had information in our press release yesterday. I also want to share the news that we will be opening a special walk-in clinic for school teachers, staff, bus drivers, and those that need their third dose booster among that group, including childcare workers as well, who haven't been able to access a booster appointment to date. We know that people will feel more comfortable when they are boosted, and we want to make that as accessible as possible. So again, I want to end by saying that schools are not dangerous, but nonetheless, we're working as hard as we possibly can to put measures in place to help support and help everyone feel safer. Please take advantage of these webinars and upcoming information, including I'll be on with a member of Parliament, Michelle Ferrari, this Friday on a Facebook Live session to answer questions with parents. So please take advantage of these sources for information, and please take care as we go through this difficult month of January together. Thanks.
Thank you very much, Dr. Pigott. Lots to cover today. Okay, so now we'll turn it over to our media guests, and I'd just like to point out we do have several of our enforcement partners on the line with us today from the Peterborough Police Service and the OPP, so thank you for joining us. So let's begin with Matt Latour from Oldies and Freak Radio station. So if you've got some questions for Dr. Pigott, Matt, please go right ahead. Happy New Year.
I do, and I get to go first in 2022, so I'll take that too. All my questions today are for Dr. Pigott. My first one was just, I guess, a kind of a general message for anybody that's saying, COVID is just the thing we have to learn to live with, and it's just a cold. What would your message to those kind of people be?
I think that we will eventually get there. But I think that we are not there yet. I think that there are people that comments like that make feel incredibly anxious. People whose family members or themselves may be immunocompromised, may have medical risk factors for severe disease, or may have kids like me that are under 5 and haven't had their chance to get vaccinated yet. We know that this pandemic has taken an incredible toll in the loss. We know that we need to get back to society functioning and ensure that there isn't continued disruption of the social fabric of our society and economy. But we still need to be very vigilant and careful in the face of Omicron and the pandemic. But thank you for the question.
My next question had to do with the Omicron variant specifically. Is there any, I guess, evidence that suggests maybe it takes a little longer to resolve than any previous variants, or is it too early to tell?
No evidence that I've seen on that yet. We're still learning a lot about this virus, this variant. We know that it appears to be causing disease maybe a little bit quicker, and that may mean for some people, especially those that are vaccinated, that they get better quicker as well. So that's encouraging. But it can affect different people differently, and especially those that are unvaccinated remain at significant risk of the more concerning severe disease, hospitalization, and death.
Is it known if the 30th death, the resident in their 80s, you mentioned they were double vaccinated, is it known if that was Omicron, Delta, or any other variant?
I don't have that information right now. With the changes and with lab right now, there are some challenges with some of that information. But we are seeing most of our cases now being Omicron. Still, obviously, some leftover cases near the end of last month with Delta, but the majority of cases we're seeing now, a vast majority, are Omicron.
And my last question had to do with the PRHC outbreak. Is it known if that's in a specific unit, or is it just the hospital as a whole?
I would have to defer that question to the hospital. Yeah, thank you.
Perfect, thank you.
Thanks so much, Matt. Okay, let's invite Jessica Nisnik from Global News Peterborough. If you've got some questions for Dr. Pigott, you please go right ahead.
I do. Thank you, Brittany, and Happy New Year, everybody. So, Dr. Pigott, you said schools aren't dangerous.
The one making them, and I don't think that's my place to comment. What I'm doing, I'm just a doctor working as the medical officer of health here to help and support schools, to support everyone in the community, to make it a safer place.
That's very fair. Thank you, Dr. Pigott. Some questions around, we don't have access to rapid testing. So, you know, a lot of us, if you have a symptom, assume you're sick, right? So if I have a symptom, you know, in February and I have to take at work here, they're still mandating us to take 10 days. So then if I have a symptom in March, I'm expected to isolate again, right? How many times, especially during cold and flu season, I won't know if I had COVID because I can't get a rapid test. And so I'm just to assume I have COVID each time means I have to keep taking 10 days off work. So what do you recommend in that situation? Because we're just to assume we have COVID.
Thanks, Jessica. It's a difficult position, and I feel for people. I think a couple things. One is, as our MPP, Dave Smith, mentioned, Jessica, for you, I think that the rapid antigen tests are going to improve in supply very soon. So I think they will become available, and they will be another tool that will help us. And in the intervening time, I think the best advice that I can provide is it's really important to continue following the public health guidance. On the second piece about repeat infections, we don't think the likelihood of repeating that quickly will be there. But there is still some uncertainty around this virus. I think for employers, wherever possible, to allow people, if they're well enough, to work from home and they have the kind of job that they can do that, I think that's really important. And people may want to or be able to continue working from home, but that's a luxury a lot of people won't have. And I understand and respect that. And I know that the province and in the guidance that public health is thinking about, they're thinking really hard about both stopping the transmission of Omicron as well as the impacts on people and people's livelihoods and our society. So I definitely empathize, Jessica, and I hope the situation improves very soon.
But just to be clear, you have a symptom, you still isolate for 5 days, no matter if you keep getting a symptom month after month.
Yes, that's the current guidance, Jessica.
Okay. Lastly, what are some ways that, I mean, I'm assuming it's treated like the flu, lots of rest, lots of fluids, that kind of thing. But I was kind of going to try and focus maybe on how to treat this. What is the best way to look after yourself when you're at home?
I'm glad you brought that up, Jessica. And linked to that, I want to say that our message is stay home if you're sick, but it's really critical, and we don't want people to stay home if they need healthcare attention. And if people are feeling short of breath or feeling very sick where they need to seek out healthcare attention, they should continue to do so. And I know that the assessment center here in our community has been doing hard and excellent work to make sure that they can respond to people who need to be seen. I know our primary care providers, our nurse practitioners and doctors in this community have been doing a wonderful job of helping and seeing people who need medical attention. So I want to start by saying, if you need healthcare attention, you should be seeking that. The last piece is, if you are sick and you are sick with a more mild illness, it can still feel awful. I mean, I've had influenza before. I've been sick, and you can feel very sick and out of it for a period of time. The best things to do are to rest, get lots of fluid, get lots of sleep, and ensure that if you need some pain relief, things like ibuprofen or Tylenol can be helpful to help manage some of the symptoms. And as you're able to start feeling better, starting to get some activity, increase your diet, and get outside and get some fresh air can be helpful as well.
Thank you, Dr. Piggott. Those are all my questions. I appreciate your time.
Thanks, Jessica.
Okay, great. Thank you so much, Jessica. Okay, let's hear from our Kawartha Now colleagues. So Paul Rellinger, nice to have you join us. Happy New Year. Please go ahead with your questions for Dr. Piggott.
Thanks so much, Brittany, and Happy New Year to you and to you, Dr. Piggott. I had a couple questions and some clarifications, if I could. I'll try not to take too long. Before Christmas, in one of these briefings, you were very clear in indicating your worry about what was ahead in January. You said it in the strongest terms. You were quite concerned, and rightly so. Has everything that's come to pass in January kind of met what you expected would happen? Is there any reason for you? I know you're always optimistic, but again, you're very clear on what's ahead. Is this pretty much panned out as you thought it would at that time?
It is, and that's why the additional measures have been so important to helping to stop the spread in such a way that will overwhelm our health system. I think that the increases in hospitalizations that we're seeing provincially and even locally are still deeply concerning, and we are still in the early phase of the impacts of this. So the coming weeks will be really telling, and I hope that it will not overwhelm our healthcare system, and I think that but I do think it's going to be quite concerning, and we do need to keep a close eye on things as we're going into the next few weeks here. We as much as I think I see hope in the other side, we're still on this side of it, and we're still in the thick of it at this point, for sure.
Thank you. And you said earlier the numbers that we're currently seeing on the dashboard, I think your words are a significant underestimate of the current situation. And then you went on to refer to, it could be 3, 4, 5, 6 times. I think you even mentioned 10. Is that to us? I don't want to be an alarmist, but there's potentially, if we look at the number now, it's about 1,100. There could be 10,000 cases in the community right now.
Thanks, Paul, for the question. Prior to the changes in the testing criteria, the modeling estimates we saw provincially were potentially that we were underreporting by a factor of 8. So there's 8 times more cases. Now that the testing criteria has changed and we're testing a more narrow range of people, the active cases we're reporting are enormous underestimate. So I would assume that the number could be even in excess of the figure that you quoted, but we don't know for certain. At this point, we're relying on the other instruments, the other measures for a picture of what's going on, including the hospitalizations, but also our rapid antigen testing, and also our wastewater surveillance, and also other sources of information as we navigate this time in the changing context.
Thank you. And I'm sure you read about this, but I wanted to get your thoughts on it and how much you're following this, if at all. There was talk of a new variant in South France. I think I read that's been found just within the last week. It was online. It was reported. Pretty reputable news source was reporting it. Do you know anything about that, or have you heard anything about that?
So I know we're tracking, province, federal government, World Health Organization are all tracking. We never know what this pandemic will throw at us next, and it's important to keep an eye out for these emerging variants. At this point, the WHO has this classified as a variant of interest, meaning they're following, but not a variant of concern like the previous variants of concern, Delta, now Omicron before. So at this point, it's too early to comment, but certainly to think that Omicron is the last that this virus, this pandemic will throw at us, I think is wishful thinking. But nonetheless, our vaccines continue to perform very well and protect us, and that continues to be really important.
Excellent. And finally, just in reference to the most recent death, was that at a residence, a private residence, or was it in a congregate setting? Do you know offhand?
I don't have that information, and I think for confidentiality reasons, we normally don't publicize that, but Brittany, you could comment or we could follow up.
Yeah, we typically don't share that level of detail, but we are able to share the age band, the gender, and the vaccination status of the individual, and definitely age and age band and the outcome of a case. That's also captured on the Ontario Data Catalog. So that information is already public.
Oh, okay, great. Thank you. And thank you, Dr. Pigott. I had a question for Mayor Therrien, if she's still on the call as well.
Yes, I'm here.
Thanks, Mayor Therrien. I read a report out of Edmonton that they're having quite a situation with city workers, city staff being off work and how that's affecting services there. Are we in pretty good shape here at the city, or should there be cause for concern with workers booking time off sick with Omicron?
Yeah, that's a good question. I think so far I haven't heard that we've had those issues. I would have to follow up with HR though to find out if there's exact numbers. I know it's something as well that in other cities, emergency services, police services, for example, have been dealing with significant portions of their workforce off. But I don't have exact numbers for you. I'm not sure if anybody else from the city that's on might know. Otherwise, I can certainly look into it and circle back.
Great. I'm making the assumption, and maybe you can just clarify that you prepare for those contingencies. I suppose this is something that you talk about because it is a possibility, right?
Yeah, absolutely. And I mean, we 2 years into this pandemic now, we've gotten used to sort of redeploying staff from some of those facilities that are closed into other areas where they're needed. And so most of our folks have been extremely amenable and adaptable to that. But again, I don't have specific numbers. I'd have to do that research and let you know.
Thanks so much. And Mayor Therrien, thank you, Dr. Pigott, and thank you, Brittany. That's all I have today.
Great. Thank you.
So sorry, I just saw Jody DeNoble just put in the chat that she would have some additional information about that question for Paul.
Great.
Thanks, Mayor Tarian. I can comment that we are tracking the number of staff who are indicating a need to isolate either due to symptoms or being a household contact. We do have a corporate business continuity plan, and we have had meetings and are reviewing on a division by division basis and adapting our services and staffing levels accordingly. So far, we've been able to manage. We aren't in the critical state that some of our other municipal colleagues are finding themselves in. But I will say that definitely we are, like every other workplace, where we are seeing absences, and we are continuing to monitor. And when and if need be, we will make adjustments in service levels and redeploy staff. But so far, we're managing with the plans that we have in place.
Thanks so much. That's a big help. I appreciate that.
You're welcome.
Great. Thank you, Jody. Thank you, Mayor Tarian, and thank you, Paul. I noticed that Janine Taylor from Kawartha now is also on the line. Janine, did you have any questions for our speakers today or for Dr. Pigott?
I don't have any questions. Thank you for acknowledging us. I defer to Paul for our coverage, and I just wanted to say Happy New Year to all of our media colleagues who deal with this pandemic and situation in a very different way, on a very different type of frontline. Thank you.
Okay, thank you, and an excellent point. And
Thanks,
Happy New Year to you too. Thank you, Janine. Okay, I see Bill Hodgins is here with us from Peterborough this week, and also reporting in from the Examiner. So, Bill, if you've got some questions, please go right ahead.
Thanks, Brittany. A couple of questions for Dr. Pigott, please. The first goes back to boosters. A couple of weeks ago, there was, I guess, a move to prioritize the Pfizer for the younger 30 and under. Are they available to those 30 and over yet?
We haven't received a word. We're hoping that the supply will improve, but at this point, that hasn't changed.
Is there any reason why the Pfizer supply is lower?
That is a question for, I think, the federal provincial governments. I'm not sure. I know that there are shortages broadly, though.
Okay, thanks. And a second question to do with, you mentioned self-reporting of the rapid test. Are you seeing a lot of people do it? And has it, the numbers you're getting, has it made a difference in terms of actions of the health unit?
Yeah, thanks for that question, Bill. And so I would encourage people to continue to report. We have information in the link on our website, and it is very helpful to us. We've had over 2,000 people respond so far, and many of those people respond in reporting negative tests, which is just as helpful for us to understand what's happening and what's out there. And we are using that information to help continue to track the spread of the pandemic. So it is helpful, and I anticipate in the coming weeks we'll also be able to start sharing some of that information publicly. We're working through the technical considerations around that, but it is definitely helpful information, and we deeply appreciate all those who've been contributing.
All right, that's it for me. Thank you very much.
Super. Thank you so much, Bill. Okay, Reg Watson's on the line from the Examiner. Any follow-up questions, Reg?
No, thank you.
Okay. Then I think that brings our media briefing to a close. As I just quickly scan the list, I don't think I see anyone else from the media that I've missed. If so, feel free to put your hand up. But as we always do, we have been recording this, and we will save the link to our YouTube page if anyone needs to refer to it after the fact. But I'd just like to thank you all again for joining us. We will be back here again next Thursday at noon. And please stay safe out there and take good care. Thanks again to all of our speakers and to our elected officials and media for joining us. Thanks now.
Thanks, Brittany.
Thank you.